And one more view of the elbow joint here, lateral view, showing you how there's also a hinge joint at the elbow. You can see the ulna with its olecranon or olecranon process, and a little hint there of the coronoid process, and the trochlear notch of the ulna, and then that's the trochlea of the humerus. And you can see the nice round head of the radius. So lateral view of the shoulder joint, elbow joint. It is classified as a hinge joint overall. Okay, let's move to the wrist bones. Our carpals, 8 of them in each wrist. So we'll start with the scaphoid. So this is the right wrist, anterior view, palm facing forward. This Roman numeral 1 is metacarpal 1, heading towards the thumb, and this 5 is metacarpal 5, heading towards the pinky. Okay? So anatomical position, palms facing forward, right wrist. So you can consider the carpals in 2 rows. Proximal row of 4 from lateral to medial, and then the distal row of 4 from lateral to medial. The proximal row articulates with the radius and ulna. The distal row articulates with the metacarpals of the palm. Okay, so the scaphoid is that first carpal that's most proximal and lateral, articulating with the radius. Then there's the lunate, which is next, also articulating with the radius and a little bit of the ulna. Then the triquetrum is this one here that's just underneath the pisiform, and the triquetrum articulating with the ulna. And then the pisiform here, small one, articulates with the ulna as well. So there you go, scaphoid, lunate, triquetrum, and then there's the pisiform. Okay, so that's the proximal row of carpals. Moving to the distal row, trapezium first, so lateral to medium, trapezium, articulating with the scaphoid and metacarpal 1. Then the trapezoid, scaphoid and metacarpal 2. Then the capitate with the lunate, metacarpal 3. And then lastly the hamate with the triquetrum, metacarpal 4 and 5. Here's another view of the wrist, zooming out, looking at the metacarpals and phalanges. So the metacarpals, the hands of the fleshy part of your palm, are numbered with Roman numerals 1 through 5, not Arabic numerals, but Roman numerals 1, 2, 3, 4, and 5. And then number 1 would be the metacarpal that goes towards your thumb, 5 towards your little finger. All right, and again, this is the right hand, anatomical position, palm facing anteriorly or forward. And then the phalanges or the digits are also numbered with Roman numerals 1 through 5. And the phalanges have a proximal, middle, and distal phalanx. Phalanges is plural. So each finger has 3 phalanges except for the thumb, which only has the proximal and distal phalanx. So just look at your hand, you'll see that in the thumb there's only 1 joint right there, and in your other digits or phalanges you have 2 joints, there and there, there and there. And then the thumb is so important, we give it its own special name, the pollex, or just phalanx 1. And if you call it phalange 1, that's okay. Okay, let's move down to the pelvic girdle and lower limbs. So the hip bones are also called the os coxae or pelvic bones or coxal bones. Probably hip bones is the easiest to remember. So you have two hip bones, a right hip bone, which is what this is, and the left one. The longest, heaviest bone in your body is the femur, your thigh bone. Then there's your patella or kneecap, excuse me, which is a sesamoid bone. And then distally, you have the tibia and the fibula. So somewhat analogous to the upper limb where we have one humerus and the radius and the ulna. So in the leg, we have the lower appendage, we have the femur, tibia, and fibula. And then the tarsals are your ankle bones, including your heel bone, which is one of the ankle bones. And just like in the hand, we have now metatarsals, not metacarpals, but metatarsals, and phalanges, your toes. So the pelvic girdle is considered two bones. The left and right coxal bones are your hip bones. At birth and during development, embryological development, it's actually three separate bones which are connected by cartilage. The three separate bones are the larger ilium, which is more superior, the smaller pubis, which is more anterior, and then the ischium, which is kind of in the middle in terms of size. So this is the right hip bone or coxal bone, notice here. And by about 25 years of age, they fully ossify and fuse together, meaning the cartilage between them becomes bone, and it's considered one bone, the hip bone or the coxal bone or os coxae. Okay? And this is the right hip bone, looking at it laterally from the side. The pelvis is considered the two hip bones with the sacrum, which we can't really see here, a little bit here, and then the coccyx, the tailbone. Okay, so pelvic girdle is just the two hip bones, pelvis, the hip bones plus the sacrum and the coccyx combined, which is what we see here now. Okay, anterior view. Sacrum, coccyx, and both os coxae or coxal bones or hip bones combined, this unit's called the pelvis. And you can see how the ilium of the hip bone articulates with the sacrum at the two iliosacral joints, and the pubis of each hip bone articulates anteriorly at the pubic symphysis. Okay, so some of the structures on our hip bones, coxal bones, the iliac crest on the ilium, which you can feel, you rest your hands on your hips, that's your contacting the iliac crest. There's the greater sciatic notch here. Notice that big kind of depression here, this big notch. That's the route for the sciatic nerve. Ischial tuberosity at the bottom of the ischium here. That's what you're sitting on if you're sitting down. Holds the weight of your body when you're sitting down. The acetabulum is this nice big depression laterally. The socket, that's for the articulation with the head of the femur. So nice deep, solid, strong ball and socket joint there. Then the obturator foramen. Foramen's an opening. That's the one here. Some blood vessels and nerves go through there, but the obturator foramen is very obvious. The auricular surface is seen medially, the medial aspect. So that's a lateral view. Flip it around. Here's the medial view. And in blue here, that's the auricular surface. The blue indicates some cartilage. And that's the surface that articulates with the sacrum at the iliosacral joint, which is what we would see here, okay? So the surface of the sacrum that articulates with the hip bone of the ilium of the hip bone, right? Those surfaces there, articulating surfaces, auricular surface on the hip bone. And then the pubic symphysis, seen here, the articulation, the joint between the pubis of each hip bone. And notice the blue here, that's the cartilage at the pubic symphysis of the pubis of the hip bone. Here you go, sacroiliac joints, and then the pubic symphysis anteriorly. Some comparisons, male and female, female-male coxal bones and or pelvis. There's a wider ilia, the iliac crest, on the female versus the male. The male, the hips are narrower, the iliac crests don't flare out as much. The pelvic inlet, this top red arrow, is wider and larger than in the male. And that's because in the female, this serves as the birth canal. In the male, it does not. A large pelvic outlet. The narrower red arrow between what's called the ischial spine, that's referred to as the pelvic outlet, and again it's wider in the female than in the male, and again because this serves as the birth canal in the female. Broader pubic angle, notice down here on the pubis, this pubic angle is broader, wider than in the male. Less curvature of the sacrum and the coccyx in the female versus the male, and again to accommodate the passage of the baby during birth. And if you were examining a male and or female pelvis, the most obvious thing to recognize between the two would be the broader pubic angle in the female versus the male pelvis. Okay, let's move down to your thigh bone, the femur, largest, biggest, heaviest bone in your body. The head of the femur, very obvious, articulates with the acetabulum, there, there, and there. Okay, of the hip bone. The constriction here is the neck of the femur. Nice large greater trochanter on the femur. Nice big bony protrusion for attachment of our strong hip muscles. There's the lesser trochanter, similar function, but not as large. Condyles, lateral and medial epicondyles. So this is the proximal epiphysis of the femur. If we go down distally towards the knee joint, there's the distal epiphyses, and it has the epicondyles, lateral and medial epicondyle, analogous to the lateral and medial epicondyles on the humerus, your upper arm bone. Notice that the head of the femur has to be medial because it articulates with the acetabulum of the hip bone. So if you go distally, this has to be medial. So that's above the condyles, that's the medial epicondyle, and that has to be the lateral epicondyle. Okay? The greater trochanter is a lateral protuberance. All right. And then the condyles, articulating surfaces with the lower tibia. And just like with epicondyles, there are a lateral and a medial condyle. The patella, right? So it's right about here. This is the anterior, and that's the posterior view. Oh, by the way, on the condyles on the femur, notice that this is anterior, front. The condyles don't come that high up in the anterior aspect of the femur, but if you flip it around and look at the posterior, the back of the femur, those condyles go up quite a bit. So that's one way to recognize the anterior versus posterior view of the femur. Plus there's this pretty obvious line called the linea aspera on the femur posterior that's not on the anterior aspect. And think about that. That should make sense. If you're standing upright and you lift your heel up towards your backside, your buttocks, notice the way your ankle moves in terms of that joint. Your heel goes back towards your rear end. That means your lower limb legs, lower limb bones, the tibia and the fibula, also move back, and that's accommodated or made possible because these condyles come pretty far back on the posterior view.